360-degree approach to the management of autism. What exactly is this? And I'll show you how everything is changed in this field now. It's time we changed our thinking. It's time we looked at the half full in the bottle and not the half empty. Because if we do that, these children have potential to change the world. In fact, some of the greatest inventors, discoverers, entrepreneurs, they may not have had autism, but they had some amount of ADHD, learning disability, but they changed the world. We are going to look at what I call a 360-degree approach to the management of autism. What exactly is this? And I'll show you how everything is changed in this field now. Before I begin, I want to make a disclaimer that this lecture is for information purposes only. It is not a substitute for a medical consultation for which you should consult your regular doctors, that each child with special needs is different and will require individualized treatment. The information in this talk is generalized, and whatever clinical results I mention here have already been published in peer-reviewed medical journals. So my talk will be in 4 parts. The first is an explanation for what happened in the White House recently. We had President Donald Trump, we had RFK Jr., the Health Secretary, and the FDA Commissioner talk about some things that I'm sure all of you have heard of. Now we are in agreement with that, and I'm going to explain that to you. I'm going to explain the science behind what they said. We will then look at what is new in the science, what is new in the understanding, and this is from our own research findings. This is not from the internet. The research that we have done, this will be a little technical. Please sort of ignore the details, but at the end, I want to make a point. And from the science, we'll go on to management. What is new in the treatment options? We all know what autism is. It's a complex neurodevelopmental disorder. The problems being social interaction, communication, and repetitive behavior. So this is what has happened with all of you. All right. You had an evaluation done by a pediatrician or psychologist. You were given a diagnosis. For many of you, it was the first time you ever heard that word autism. Then you were told, take rehabilitation therapies. If your child was hyperactive, maybe you were given some medicines. Almost no specialized investigations. Nobody did a brain scan of your children. Autism is a brain problem. And then you were told there is no definitive treatment. Is this correct? You're given a diagnosis. You're told take ABA rehab. No test done, and you're told no treatment. Now, I'm going to tell you what has changed now. What has changed is that after the diagnosis, it is possible to do detailed brain imaging, which we are doing now. So, an MRI and a PET scanner, I'll show you how that information is so very useful. There are some routine and specialized biochemical investigations that are very informative. There's genetic testing and there is testing of the gut. So we are doing all of this, and I'm going to share that information. After that, apart from rehab, we've got cell or stem cell therapy. We've got oxygen-based therapies like hyperbaric oxygen. We've got micronutrient supplementation. Leucovorin, we're going to talk about it because that's been spoken of the FDA, and gut cleansing. So now all of this is possible. Detailed evaluation is possible and available, and a detailed management is possible. So what was told that nothing can be done for your children is no more true, and I'm going to show you the science and clinical data behind that. I've been working in this field for over 20 years now, and never in these 20 years has any head of state, any president, any prime minister ever spoken about autism. But last month in the White House, you had the President of the United States, you had the Health Secretary of the United States, you had the FDA Commissioner of the United States, the 3 most important people with regard to health. And I'm briefly showing you just snippets of what they spoke and will try to explain what they said.
Been waiting for this meeting for 20 years, actually. And it's not that everything's 100% understood or known, but I think we've made a lot of strides as we announce historic steps to confront the crisis of autism. Horrible, horrible crisis. It's 1 in 12 or 1 in 31, and now we're at the level of 1 in 12 in some cases for boys, 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%.
To autism for pregnant women, infants and toddlers, our research has revealed that folate deficiency in a child's brain can lead to autism.
Today, the FDA is filing a Federal Register notice to change the label on an exciting treatment called prescription leucovorin so that it can be available to children with autism. You know, autism may also be due to an autoimmune reaction to a folate receptor on the brain, not allowing that important vitamin to get into the brain cells.
So now you all aware of this, you've heard of this, right? Yes. Okay. Do you all understand this? Because now I'm going to try to explain this a little bit. The first, what President Donald Trump said, he spoke about the increasing incidence. You can see in 1970, it was 1 in 10,000. Then around 2000, it was 1 in 1,000. And then you can see the graph, how it has gone up. It's become 1 in 31 now. Now, these are figures from the US CDC. And at this rate, you can see every year it is increasing. Last year it was 36, before that 41 in 44, 1 in 54, 1 in 59. At this rate, the next year it will be 1 in 20. And then it will be 1 in 10. And then 1 in 5. This is as per this graphic, unless we do something about this. All right, that is why the causation of autism is extremely important. This is a graph, and it's a 25-year graph. It's not like some 2-3 years, and it's progressively increasing. So we now have almost 70 million affected families. That is 1% of the world's population currently. That is the incidence of autism today. Now, the Health Secretary, RFK Jr., spoke about folate deficiency. So I'm going to try to explain this a little bit. So what exactly is folate? Folate is something which is very important to the cell to regulate our genes, to have normal brain function, normal neural development, and to synthesize DNA. It's a very vital component. If there is less of folate, the brain doesn't develop, the genes aren't regulated, and DNA cannot be made. So there are different types of folate. Now there is folate, there is folic acid, there is folinic acid, and there is methylfolate. I know they are technical, I don't want to confuse you, but to just give you an idea that we normally from our food get folate, which is in an inactive form. Folic acid we get as a synthetic supplement, now both of these are inactive. All right. So I want you to remember that both of these, what we get in our food and what we get in supplements, are inactive, and they have to be converted into an active form. On the other hand, folinic acid and methylfolate, these are active. So inactive, the way we take, active in a different form. Now what we have found is that there is a gene which actually converts the inactive to active. Do you understand that? So you have to we are taking something, the brain can't use it in that form, it has to be converted. All right. So there is this gene, and what we have found is, I'll repeat again, we take it in our food, we take it in a supplement in an inactive form, it has to be converted into an active form, and that requires a particular gene. And what we are finding is that in 73% of our children, this gene is defective. That means in 3 out of 4 children with autism, the inactive folic acid cannot be converted to methylfolate. I know it's technical, but are you with me? Yes. I'm happy to repeat this. So the problem is here, all right. Now, this is just a very technically busy slide, but to tell you that when there is folate deficiency, a whole lot of things happen which can lead to autism. Now, how do you bypass it? So what you can do is you can supplement directly with methylfolate, the active form, and we have seen that, and I'll explain this how we work. I'll explain that subsequently. Now another thing, and again the FDA commissioner spoke about antibodies. Do you know what this is? All right. So antibodies are a body's defense system. So when we are giving the child, or even pregnant mothers are taking folic acid in an inactive form. The body can't use it, so what happens? The levels go up. It's clear, I'm taking something, the body can't use it, so the levels go up. When the levels go up, the body in defense tries to protect the cells from an excessive amount, and it produces what are called antibodies. It's a protective system, but what happens is it closes the door. So inactive folic acid has to become folate. It has to enter through that door. That door is called a receptor. I'm mentioning this because the FDA commissioner mentioned that in the video. Now, when antibodies are formed, the door is shut. So now this vitamin cannot come into the brain. So now this is all a little technical, but I was just trying to explain that to you in a relatively simple form. So eventually you have the brains, and I'll show you the science. We've done a lot of research on this. Our children with autism have got less folate in the brain. We've checked this in their blood, we've checked this in the urine, and now because we've also checked it in the cerebrospinal fluid of the brain. And low folate leads to problem with speech, problem with social interaction, and hyperactivity, the classic symptoms of autism. If our brain didn't have folate, we would have the same problems. Because low folate level, it affects the transmission, the neurotransmitters, and repair of the nervous system. So again, just to show you that there is a blockage, there is a folate receptor, and that gets blocked. All right. So the way to work is to bypass it. So what exactly is leucovorin? Leucovorin is a system where you bypass that gate. So folic acid can't come from here. Well, you use another door, and that door is leucovorin. Okay, I can't make it more. It's actually very complicated, but I'm just trying to make this simple. All right. Are you with me? Yeah.
So with the folate deficiency, it starts with the mom. Is that correct?
What?
With the mother when she's pregnant.
Yes, it starts with the mother. And it happens because during pregnancy, folic acid supplementation is being given more than it is required. It was advised for 3 months in a low dose, but it is being given for the entire pregnancy in a higher dose. So that is the fundamental problem. So to explain what is leucovorin, well, this is blocked. So we bypass it. So there is something called reduced folar RFC. We just open another door. All right. So leucovorin bypasses this door. It comes from that door, and it now gives folate, methylfolate to the brain. Did you follow? Yeah. All right. I know it's all technical, but so leucovorin, which is called folinic acid, bypasses that and then gets through the brain and becomes folate and then gives the brain what it needs. Now, what are the benefits? It leads to improved speech, better social interaction, reduced irritability, enhanced attention, and supports sleep. But it has got side effects, and one of them is hyperactivity. So there are behavioral changes. Otherwise, it's generally well tolerated. You can also have some sleep disturbances. You can have GI, but the major problem we have seen is behavioral changes. So we've been using leucovorin since January 2024, and we combine it with a treatment of cell therapy, rehab, and integrative therapies, what we noticed was faster improvements in speech. Okay, so this is, our children were improving, but speech was the one thing which was not improving as fast. It was taking 2 to 3 years. Understanding was improving with our cell therapy. A lot of things were improving except speech. So we have been using this for a long time. But in summary, I can say it's a safe drug. Okay, it may be used. Hyperactivity is a major issue. Some of the kids get extremely hyperactive, very aggressive. They will start beating and scratching and a whole kind of things, but it is transient. You have to bear with it. The benefits of leucovorin are much more than the side effects. So that is about leucovorin, since everybody wants to know. Do you have any questions?
My son doesn't have that mutated gene.
Yeah.
But still we are giving the leucovorin. Is that beneficial?
Yeah, it is still
When we
beneficial.
do not have the gene deficiency?
Yeah, because even if you don't have the gene deficiency, sometimes these antibodies are there. There is a blockage. So we have studied that. I'm going to share all that information. So I believe,
Okay, you mentioned 3 out of 4 kids.
Yeah.
So what happens with that one out of 4 that don't have these full lineage?
So they are the kids they have, actually what we have been studying is that they have speech. They are not totally non-verbal. The ones that don't actually are lesser. There are some kids which have what is called, so now there is a new word that is coined. It's a little controversial. It's called profound autism. There's a controversy whether we should use the word profound. So there's a lot of back and forth. And you were there in Orlando where Temple Grandin was discussing this. We are finding that the milder kids with autism are the 1 in 4 who don't have this problem. The others are the more severe ones. Yeah? All right, so these are our results and we're having better improvement. So that was about the first part. Please.
So the recording, what we saw is more of the vocal singing, but
Yeah.
it is a clear word.
Yeah.
Whatever he read,
Absolutely.
whatever he watched,
Yeah.
he's able to. If I know what he watched or
Yeah,
read,
yeah.
I knew the story he's telling. But the school and all, it's more of the complaint, and it's more scripting in the past. And all.
Absolutely.
Is it not-
So this is part of the leucovorins, what we would call, I wouldn't call it an adverse event. It's the leucovorin working. And as the brain gets stimulated, you will see this, but it is transient. We find that it does settle down over a period of time. Yeah. Somebody at the back, yeah.
So, my son has ADHD, he's very hyperactive. So it's safe to give the leucovorin?
Yeah,
Because
it's safe.
It's going to have side effect for hyperactivity, so it's going to be more.
Again, how's the speech?
Speech is he can communicate, but not
Okay, the answer to my question is I would like to do an MTHFR gene test, all right? If there's a problem with that, then I would give the leucovorin. Okay. All right, so now we're going to talk some science. Now this is very technical, so just be with me, okay? You'll see a lot of data, but I just want to rush it through. The conclusions are important. So we're going to look at the genetic findings, biochemical findings, gut microbiome, and neuroimaging. Now this is our own data. This is data that we have generated from Neurogen. So what are the genetic findings? MTHFR. So if you see, it's a technical busy slide, but we studied 1,000 patients and we found again that, as you can see, that a significant amount of patients, close to 74%, have a gene mutation. So this is a lot. This is our own data. We checked the gene mutation in 1,000 patients and we found this is technical because there are some subparts. Some have a particular gene, some have another one. Now what we did is we compared, that is to answer your question, we looked at the symptoms in the ones, so we noticed that all the symptoms, speech, hyperactivity, aggression, the incidence was higher. Look at that. The incidence was higher when the MTHFR gene mutation was present. It's 56, 69, 57, 58. So we compared the gene mutation to the symptoms and we found that the symptoms were more severe when there was a gene mutation. This is that same data you can see in a graphic form. With gene mutation, speech issues in 56%. Where there was no gene mutation, 21%. I mean, that's to answer your question. Okay, same thing in hyperactive, aggressive, and everything else. So, with MTHFR, there is a much higher incidence of these symptoms. Now we come to folate receptor autoantibody. Again, they found, research shows that 50 to 75% have this, and this is our own research. We've studied 69 patients so far, and we found that 37% of them had higher levels of the autoantibody. And again, we found that the ones who had a higher problem, the symptoms, you look at this, the symptoms were much higher. So if you have an antibody, 94% of these kids had a severe speech problem, hyperactivity, aggression. This is data, but just to let you know that there is a correlation between what's happening with the gene, what's happening with the blood, and what is happening with our children. All right. And again, you can see that, if they're autoantibodies, 94%, those who didn't have it, in that, I don't know if I'll explain this data. If you have an autoantibody, amongst those, 94% had speech problems. Amongst the ones who did not have it, only 5% had. So there is a direct correlation with everything. Now we'll come to neurochemical findings. So neurotransmitters in autism. These are technical words, but just because parents tend to read a lot, and you have, so just to explain to you, there are some chemicals like serotonin, dopamine, glutamate, GABA. Some of them are excitatory, some of them are inhibitory. For example, serotonin is a mood regulator, dopamine is for reward processing, glutamate is for for activity, and GABA creates anxiety. And these are other chemicals: epinephrine, norepinephrine, oxytocin, still other chemicals. I'm just running through these because they're a little technical. This is what we found. This is our own data. We studied 261 patients. We found low GABA, low phenylalanine, low dopamine, and low histamine in these percentage of patients, whereas this was the percentage where these chemicals were higher. You don't have to remember all this. What I want you to understand is there is now science to show that our children are not just, they don't have speech just because they don't have speech. They don't have speech because there is stuff happening in their brain. And if there's stuff happening in the brain, it can be fixed. But you have to first know it. So that's what we are generating data. Again, now that was blood. Now we looked at the urine. Again, we found low neurotransmitters of these, and we found elevated transmitters. And then we studied the CSF. The CSF is the cerebrospinal fluid. It's the fluid that bathes the spine. And this is again what we found: low neurotransmitters, high neurotransmitters. Then we did something very interesting, and nobody has done this in the world before. Nobody has done what I'm going to show you, because this is unique data. In fact, I am also presenting it for the first time. We did clusters. We took combinations, that if taurine was low, histamine was high, and we found that with this particular cluster, you had a particular set of symptoms. So kids who have more stereotypical behavior, who have more hyperactivity, low sitting tolerance, had a particular pattern. And that was interesting. This shows why every child is different. Every child is unique. So this is our own data which showed what we call clusters, some increase, some decrease, which means each child of autism is different. No two children are the same, but they belong to clusters. So a particular type child will have this, a particular child will have that, and so a set of children will have increased dopamine, increased glutamate, increased norepinephrine, decrease this thing, and they will have problems with attention, eye contact. So this is again very exciting data, which means we need to individualize our treatments. No two children of autism are the same. One size doesn't fit all. So this is again data that we are producing. It's technical data. I'll run through fast. And this is just to show you that we can literally create what is called a blueprint or a fingerprint of what is happening in these kids. So this is just scientific data. Now we found, for example, picky eaters belong to cluster 7 and 8. Those who have self-injurious behavior belong to one cluster. Those who have problem with social interaction belong to another cluster. So we are starting to put together all this data. Now we look at the CSF. So again, this is again similar. We are just putting all the data together, and it's technical, so I'll skip it. This is the data of the urine. So we look at blood, we look at urine, we look at CSF. So that is the conclusion. One, that the mutations detected have a direct correlation to symptoms. Two, our FRAT analysis shows an inverse correlation. So when there is an autoantibody, there is low folate in the brain fluid called CSF. And we are looking at these clustering analysis. What we've also found from our data is the folic acid was elevated in 51% of our children. Vitamin B12 was also elevated. Something called homocysteine was less, but what we have found is vitamin D3 is deficient in a significant amount of our patients, over 80%. So this is just to show you that there are elevated folic acid, elevated B12. Why am I showing you this? Because we keep giving supplements to our children without doing the evaluation, and we are making their brain worse. We are creating autoantibodies. We should stop this giving a bucket full of supplements to our kids. That's the reason why I'm showing you all this data. All right. You're wondering why I'm showing you all this technical data. Our child is different. We need to look into what is happening and give them only what they need. They already have a significant elevated levels, and then we keep giving them more vitamins. Just because something is good, it doesn't mean it is good for your child. Did you understand that? That's what this data is showing. We are also finding that there are low vitamin D levels, 81%. 81 is a huge. 81% of our children have low vitamin D. Where does vitamin D come from? You know where it comes from? Exposure to the sun. But, yeah, sorry.
So, is there one unique test that you can provide in order to do that categorization? Or does it
No, you have to look at the blood, you have to look at the urine, you have to look at the gut, you have to look at the CSF. That's what we do. All the children who come to us, we are looking at everything now and giving you a comprehensive report saying this is the problem with our kids. There isn't one test. You're asking one test? No, it's a whole.
How often should a kid have in order to see the pattern's behavior? Every 6 months, a test like this?
No, you do it once. Suppose you know that vitamin D is low, you correct it. Okay. Then you only do the tests which are abnormal. You don't have to do everything again. Okay. All right. So now the gut. Now we all know that there is a gut-brain axis, and I want you to we got a surprise for you. Okay. We are going to be joined by a legend right now. You all heard of Vikas? Have you heard of Bungalow? The restaurant Bungalow. The chef Vikas Khanna. He's coming right now.
Michelin star.
It's a Michelin star restaurant, and with him will be Maisha. She's who actually looks after the restaurant, and so now that becomes very important. We are going to have a world-renowned Michelin star guest with us shortly. Yeah. So the gut. Okay. The most neglected part, but a very important part, because the gut is considered to be the second brain. The number of neurons in the gut is second only to that in the brain. There are millions of neurons, and it affects behavior, it affects the immune system, it affects neurotransmitters. So there's a direct gut-brain connection. And we have found 70% of our children have a significant issue, 71%. So it can lead to a whole lot of these problems, in particular a leaky gut, constipation, inflammatory bowel disease, etc. And that causes all these symptoms. So this is again our research from 1,000 patients. So this is what is a probiotic. These are a list of probiotics, and we found that in these percentage it is less. Okay, so these are absent, not just less, absent. We all, you know what probiotics are? They are the healthy, they are the good bacteria. They help in digestion. You know, this particular one is absent in 59% of our children, 54, lactobacillus tuberculin, 70%. So a significant amount of children they're absent. So we need to supplement these probiotics, but we should do it after a test. That's another probiotic, and you can see this is the percentage where this is all less. So all these probiotics are missing in our children's gut. We need to correct this. Yeah.
I noticed you only do age group 2 to 18. You don't have adults or like.
No, so the number of adults is smaller, but when we do research, We have to restrict to a particular group. Otherwise, the data gets skewed. See, this is part of research. So if we have the entire thing, so for 2 to 8, we know these should be there and they are absent. Now, as we grow older, our gut gets deranged anyway. So now if we look at older people, we don't know if I do yours or mine, we may have these problems. Children are not supposed to have problems. Do you understand? That is why we look at 2 to 8. Yeah?
So the 1,000 people is age group 2 to 8.
That will be. This is part of science protocol. We have to restrict age to get results. Yeah? Now so that was what was missing. This is what is there which should not be there. So 50% at an E. coli infection, 50% at a Shigella, there are fungal infection, protozoal infections. So these infections should not be there in the gut. So our kids don't have good probiotics and they have all these infections which shouldn't be there. So probiotics are absent and this is again showing absence, and so this is what it is causing. I'll just run through this a little fast because these are the infections which are there. Again, these are all the infections, this is detailed. So what we are finding in the gut, there is low level of vitamin A in the gut. This is not blood, gut. We are finding in the gut increased levels of vitamin B12, B7. So it means the body has more vitamins and that's being flushed out in the gut. We found that these neurotransmitters are less and this one is more. This is an excitatory one. So that is why they have their hyperactive behaviors. So this is a summary of all our data. Basically again, what we did is, we did this before when the children came to us for the first time. Then we did our stem cell therapy and when they came the second time, we repeated it. And what we found is a lot of those things actually got corrected. And that was the most exciting part, that the things which were less started improving and the things which were more started decreasing. This is the most exciting part of our work in the last 20 years. For the first time ever, looking into the fluid in the brain, we could see this correction happening. This is just raw data, but this is just to show you the correction part. Now we come to the neuroimaging. Now, one thing I never understood, autism, cerebral palsy, these are all neurological problems. And all over the world, nobody even does a scan. Imagine if you have gallstones and nobody does an ultrasound. Imagine if you have a fracture of the leg and nobody does an X-ray. Does that make sense? And nobody looked into a kid's brain. All right. We have done that work. We've done 2 kinds of scans. One is a PET scan, which is a scan in color, where the normal part appears green and the damaged part appears blue, and we do MRI scans. And this gives us a wealth of information. So what we found is there are parts of the brain which are working less. So what you see blue here is brain that's working less. So these are technical terms, but this is the main part is the cerebellum, which is a small brain. This is the CPU of the brain, the central processing unit, something that coordinates all the activity. In all our children, the cerebellum is hypometabolic or not working. And a whole lot of these areas are what are called the medial temporal areas that are responsible for speech, responsible for behavior, for memory, for attention. These are all damaged. And this is something we showed the world for the first time. Nobody had even looked at that. And we said, this is the reason why our children cannot speak, because their speech area is blue, it's inactive. It's not working. All right. This is the reason why they have hyperactivity. So it shows hypometabolic areas. But interestingly, it also shows parts of the brain which work more. In particular, the parieto-occipital lobe, and in some cases, the frontal lobes. So the entire focus we are shifting from what they can't do to what they can do and make them exceptional. We all know that Elon Musk, the richest man in the world, he had autism. He speaks about it. Bill Gates recently gave an interview 3 months ago to BBC, where he openly said that as a child he had all the symptoms of autism. From Albert Einstein to Leonardo da Vinci, all of these people are believed to have had symptoms of autism. That is because they have a brain that works more. And this has been the most exciting finding in the field of autism, to shift from what they can't do to shift to what they can do exceptionally well. It's time we changed our thinking. It's time we looked at the half full in the bottle and not the half empty. Because if we do that, these children have potential to change the world. In fact, some of the greatest inventors, discoverers, entrepreneurs, they may not have had autism, but they had some amount of ADHD, learning disability, but they changed the world. And we are showing in our scans why. What is brilliant about them? What is it that they can do more than others? And we've published this this is our original research. There's a prestigious journal, World Journal of Nuclear Medicine, where we published a paper showing what are the changes in the brains of kids with autism. So this is a paper published by us. Now what we found interestingly is that the brain function of kids with autism decreased with age. We didn't know that. As we studied our data, we found this is at 2, 3, 4, we found that the brain activity actually became less. We thought it would remain the same, but it seemed to be decreasing. Now this is how the brain of neurotypical children, at 3 years, it keeps on increasing with age. In children with autism, it keeps on decreasing. Why is this important? It's important because the earlier you treat, the better results you will get. All right. But there's something very fascinating in this slide. Somebody tell me what's fascinating. Somebody who's not attended my lecture before. What is really interesting in this? Somebody tell me. Yes, absolutely. Kids on the spectrum start higher. We for the first time showed that their brain activity is higher than neurotypical kids at 2 or 3. It's higher. And then somewhere at 2 years the decline starts. But they start higher. We showed the world this. This is data. It's published in a scientific journal. All right. We also did MRI studies. Now some of your kids may have got MRIs, but they are reported as normal. What we found is something very interesting. We found that the bridge, so you all know we have a right and a left brain, yeah? And there's a bridge that connects them called the corpus callosum. We found that in kids with autism, this is smaller. Nobody had seen this before. We actually studied volumetric analysis which showed that the two brains don't communicate with each other as much as they should. So the bridge, there are two completely different brains. One deals with speech, language, the other is creativity. All of us, depending on whether we are right or left-handed, have one dominant. So this is work that we found, and we published this again in a scientific paper, Abnormal Development of the Corpus Callosum. This is our paper. So again, what does our data show? It shows that 74% gene mutation, folic acid is high in half our kids. Now, I want to explain this. What happened is that the incidence of autism from 1998-2000 has gone up 400 times, 400% times. At that time, two things happened. WHO suggested folic acid supplementation for mothers. Okay, now there was a reason for it because there were kids who had what is called a neural tube defect. And when you gave this supplementation, that became less. But also at the same time, in the United States, there was folic acid fortification of everything from maize, wheat, everything else got supplement. Ever since this has happened, the incidence of autism has gone through the roof. This was something that was done, but the reason is, it was advised in a low dose for the first 3 months, and most mothers got it in a higher dose for the whole pregnancy. So that is where the problem was. Now coming to the causes of autism, I won't go into it because this is a topic all by itself. It's a 3-hour lecture. Causes of autism is a complete lecture. I can't get into this right now. But just to let you know, because a lot of you have this question, did vaccines cause autism? All right. Now, the thing is, in 1998, Andrew Wakefield published an article which clearly showed a link between autism and MMR vaccine. However, there was a lot of backlash, and this article was retracted. This gentleman lost everything. He lost his job, lost his degree, had to leave his company because he actually said this. Subsequently, however, there were multiple papers, almost 25 articles that showed there is no connection. All right. But the jury is still out on this because we have several parents, and I'm talking of, we keep a data, almost 500 parents or so who've told us, our child was doing well till 2 years and then suddenly MMR vaccine and a decline. I believe what parents say. Okay. But can we say that it is a cause? We can't say it as yet because there is not enough published. The publication articles, as doctors, we have to go by what is published. The published work shows that it doesn't. But the jury is still out on that one. Now,
One question with vaccine. So, but he's only MMR,
yeah.
not the other vaccine. Is that
He studied only MMR, actually studied the preservative in it. The preservative in this has heavy metals. So it's not the vaccine, it's the preservative in the vaccine.
understood? But the only one out of vaccinations kids in the US receive 6 different vaccines in different dosages. MMR 12.
In the first 10 years, I believe in US you received 72 vaccines. So I heard.
Yeah. The important thing is, out of all these vaccines, the issue is MMR, or are there other ones that have a heavy metal content?
Okay, if you ask me, first we don't have this. So I can't say something which is not proven. I never. So I can't comment on that. I told you I had 500 parents who've come and told me. Now, it may be either the vaccine or maybe that's the time the symptoms develop anyway. You know, it's at 2 years that the symptoms develop anyway. What I believe is the fault is multiple vaccines given at the same time. Nowadays, kids go and they get 5 vaccines at one time. That results in an inflammation in the brain. You know, you guys take one vaccine and you get fever and, you know, you don't feel good. And our kids are being pumped with multiple vaccines. And I think the fault is there. I think too many vaccines are being given for no reason. Kids in America get a vaccine when they are born for hepatitis B. That is so ridiculous. You know, I can't even... Why do we want to vaccinate a newborn kid for hepatitis? He's not even come into the world yet, all right? But that's mandatory. So I believe, I am not completely sure individual vaccines. I believe giving too many vaccines at the same time is the problem. I believe in vaccinations. We eradicated smallpox and many other polio from the planet because of vaccines. Vaccines have saved human lives. But over anything good, folic acid is good. Folic acid saved, neural tube defects. But when we give too much of it, it produced autism. Too much of a good thing can be bad. So I think we are giving our kids too many vaccinations. I mean, this is my belief. But you must not stop vaccinating. The risk from stopping vaccination is much more than the risk of giving vaccines.
In the case of the States, MMR that is given on a combined dosage, the other vaccines are given individually. The challenge with that is they're given within the same short period of time. 1-2 days.
Yes.
2-3 different vaccines.
Yes.
But the case of MMR is the one that is combined.
Yeah. So it's, again, combination of vaccines. You know, I've been talking to parents and they say they went, 4 vaccines on one day or within a week. So that we should stop. My only advice to you is please don't stop vaccinations. Do the ones that are mandatory, but please don't put them all together. I mean, that would be my advice. All right. So now we've looked at the science, we've looked at the cause. Now we will come to what do we do about it? Okay, all that science is great, but how will it help our children? So now I'm going to talk about how we will help our children. So this is just a set of videos of children, people who came to us and them sharing what it is like to have a kid on the spectrum.
At around 1 year, she had speech, but at around 1.5, she went mute.
When she was 1.5 years old, she was not giving an eye contact, not mixing with the children, and not replying to her name. So that actually triggered something is wrong.
Shihan was not at all talking, it's just everything is sign.
His focus is very poor, but very focused.
My son was completely speechless.
Never see no, you talk, then you regress.
If you cannot speak, it's not safe. Even if someone is bullying you, you cannot even say and ask for help.
Challenges were really in his ability to listen to longer instructions, his ability to sit, process that, even talk.
Some of the kids stick toes. I would see it with my girl.
Noticing more and more of abnormal symptoms, which was hard to digest.
Was not able to control himself in terms of toilets. He used to wear diapers. He wasn't able to, very picky eating.
Whenever you open the door, we had the threat of he running away. So we had to keep him contained. So unpredictable behaviors.
He was running away. He wasn't sleeping. I would stand up the whole night holding him and he would cry if I put him down.
We took her to the pediatrician. Then we got a shock. Oh, there she is suffering from autism.
When I was told about the diagnosis, first I saw the end of me. I couldn't handle the.
It's like we lost our son. He was here with us, right with us, and he is not even responding to his names.
Then what is the solution? You have to go to therapy and all.
We had several years of therapy. That did not change much for me for 8 years.
Therapies was not making any changes. Pediatricians and all say that, oh, nothing can be done.
When I saw Dr. Alok talk about the amazing results that he's seeing based on stem cell, I don't want to wait. My child is losing his time.
Now we will look at what these parents say later after the stem cells. So there was an old thinking that the nervous system cannot regenerate once it's damaged, and there's a new thinking that by cellular replacement you can repair the brain. So we will talk a little bit about stem cell therapy. So this is Stephen Hawking, one of the world's greatest scientists. He died recently, and this is what he had to say about stem cells.
I have spent my life exploring the mysteries of the cosmos. But there's another universe that fascinates me. The one hidden inside our bodies. Our own personal galaxies of cells. Today, we are on the brink of a new age in medicine. An age where we will be able to heal our bodies of any illness. All because of cells inside us,
which have special powers. They are called stem cells.
So this is one of the world's greatest scientists actually talking about stem cells. So what exactly is cell therapy? Basically, we are using good healthy cells to replace damaged cells. That's all we are doing. So if there's brain damage, we give stem cells and we repair the damage. Now this is a fracture. This is an X-ray. Can you see there's a fracture? Can you see that? Now I ask you, if somebody had a fracture of these leg bones, would you give physiotherapy on a broken bone? Would you actually go to a gym and do therapy? What would you do? You'd go to an orthopedic doctor, fix it, and then do therapy. But for our kids with autism, we are doing exactly the opposite. Here there is brain damage. We are giving therapy after therapy after therapy to a brain that will not respond because it's not functional. All right. Now what if we did repaired it? You can see this is the damage and this is the repair after stem cells. Now when you give therapy, you're likely to get much better results. So that's what cell therapy is about. Now there are a lot of papers on stem cells. Worldwide there are almost 47 papers on autism and cell therapy, cerebral palsy 62, and these are other neurological conditions. So how do these stem cells work? First, they multiply. A single stem cell can become millions of stem cells. Two, they convert. This is the most useful property. The same stem cell, if you put in the brain, becomes a brain cell. You put in the muscle, it becomes a muscle cell. If you put in the heart, it becomes a heart cell. So that's the beauty of stem cells. Wherever you put it, it becomes that. They improve the blood supply and they release certain positive chemicals. These positive chemicals then help in repair. So multiply, convert, improve blood supply and release positive chemicals. This can repair, regenerate and replace. Repair, regenerate and replace the damaged tissue. So this is the medical action. These are medical terms, how stem cells work. Angiogenesis, improve blood supply. Paracrine effect is by releasing positive chemicals. Anti-apoptosis means to prevent cell death, to protect the neurons, improve connections, stimulate the endogenous stem cells and prevent inflammation. Broadly speaking, there are two types of stem cells. You can have stem cells from your own body. These are called autologous. This is what we do. We take cells from the child and put it back in the child. You can also get them from donors. These are from outside. How do we put it back? We put it back by either injecting it into the lower back where there is a fluid called spinal fluid and it goes all the way to the brain. It can also be given intravenously into the muscles, intraarterially, through the nose and directly into the brain. But we use this method. So this is what we do. We put a needle into the bone. This bone above here, the pelvic bone, we put a needle here. We aspirate the needle and we get bone marrow out. This takes about 15 minutes. We give local anesthesia, so there is no pain, no discomfort to the child. What we have taken out, we take to a laboratory. There we filter it and separate the stem cells, and then with a very thin needle, we inject it into the lower back. So in the whole treatment, there are only 2 needle pricks. With one needle we take out and with one we put inside. No surgery, no cutting, no stitching, nothing at all. Okay, just 2 needle pricks, and we are taking our child's own good healthy cells and putting it back in the child. No artificial chemicals. Nothing from the outside. Natural healing. So we'll see a small video of how this is done. So that's the bone marrow. You can see the child is sleeping and that's the bone marrow coming out. We take it to the laboratory, which is in the operation theatre. Once we get the stem cells with a very thin needle, you can see it's a very thin needle, we inject it into the lower spine. All right, I'll just repeat that to show you. That's the bone marrow coming out. Just like you do a blood collection, that is from a blood vessel. This we do from the bone in our laboratory. And then a very thin needle, we inject it into the fluid in the lower back. So worldwide, there are several publications, but ours is the first. So we were the first in the world to show the usefulness of cellular therapy in autism. The second paper came from China, then Italy. The fourth and fifth paper came from the United States. The sixth again was ours, then Vietnam, Iran, and the US. So we've got the world's leading publications. Now, these are our publications. This was the first study. This was published in 2013. This was a small study and we had only 32 patients and 91% of the patients improved. What did they improve in? Social relationship, emotional response, speech, behavior, sensory issues, hyperactivity, attention, and eye contact. Now, please know that you don't have a 100% result. Okay, 91% improved in social behavior, 56% improved in, the symptoms, whether it's emotion, whether it's speech. So you'll notice that there is a percentage of improvement. I'm showing this slide to tell you that all children don't improve in all the symptoms. Okay, because what happens is some improve in social, some improve in emotion, some improve in speech. So this is our data. And the second paper was published in 2020 in a very prestigious journal, the American Journal of Stem Cells. This is again our paper, a clinical study. This was a larger paper, 254 patients. And here we had a 95% success rate. Again, you can see all these symptoms improve. This is the percentage of improvement of social interaction, eye, attention, stereotypical behavior, aggression, etc. So yes, there's a significant improvement, but it's not 100%. But what we found interesting is the improvements were age dependent. So in 0 to 5, 97% of our kids improved. Between ages of 5 and 10, 94%. But 15 and above, it became 91%. So as age goes by, the results decrease. This is to explain to you, very often you feel, let's wait, let this treatment become more established. But the longer you wait, the lesser are going to be the results. And then we compared before and after brain scanning. So here you can see before the cell therapy. Now this is on a Siemens machine. This is the damage before, and this is 6 months after cell therapy, and you can see that there is a significant recovery. See, all this dark blue is almost completely gone. So this is objective proof that with our stem cell therapy, the damage in the brain does get recovered. We were again the first in the world to show that there is a damage. Nobody had even seen this damage. How can you fix something that you've not seen? We first showed there is damage, then we treated it, and then we showed a resolution in the damage. So this is on Siemens machine. There's also a GE machine, General Electric machine, where again these pictures look different. So you can see this is the damage before, and you can see after the treatment there is an excellent recovery in the brain functioning. And again, now this is our most recent paper, 2025. It's just been accepted for publication. This is the largest study in the world. Nobody has published data of so many. This is 1,011 patients. We follow them up for 19 months. And what we found, again, you'll see similar improvements in attention, command, eye. This is the data. And you can see more or less the percentage of improvements is same like earlier. On the scores, there was a significant 85% improved on the ISA. This is the Indian score for autism. 85 on the CAR score. And again, here we showed a decline with age. So as age goes more, this is larger data, so the figures are slightly different. But there is a definite decline with age. And again, this is before and after cell therapy. Now, that was about cell therapy. Okay, I'll very briefly run through other things. I always mention neurorehab because neurorehab is important. The brain is a computer. It's got hardware and software. The stem cell only fixes the hardware. Software comes from rehab, software comes from the environment at home, software comes from schooling. Unless you put all that in, the child is not going to show the maximum improvement. So cellular therapy fixes the hardware, rehab and teachings at home puts the software. So, but what we believe is there needs to be a comprehensive rehab in different parts of the world. More emphasis is given to one. For example, in America, the focus is more on ABA. Almost everybody gets ABA. But they need, apart from ABA, ABA is very important, but they need occupational therapy as well. They need speech therapy as well. They need special education as well. So what they need is a comprehensive therapy program, which unfortunately in most parts of the world is not available. So we must do that. And what does the rehab do? It helps overall the results of our cell therapy by promoting cell integration, survival, and improving the blood supply and neural connectivity. Now, integrative therapies, we have since 2019, we were doing only cell therapy and rehab. From 2019 onwards, we've added what are called integrative therapies, which is basically hyperbaric oxygen, ozone, and gut cleansing. So what is hyperbaric oxygen? Basically, hyperbaric oxygen is oxygen under pressure. You all have heard of it. Many of you may have done it as well. There's a chamber, the child goes inside with the parent, and it improves the oxygenation, immunity, brain function, metabolism. So it has a lot of beneficial effects. How does HBOT work? So this is the chamber. Most children love it. They go inside with the parent. There are cartoons going on, so they really have fun. How does it work? Basically, I'll explain to you. Right now, all of us are breathing oxygen at one pressure. Okay. When you breathe at one pressure, the oxygen goes into the blood. Now, blood has got red blood cells, white blood cells, and a liquid called plasma. So right now, only the red blood cell, and in the red blood cell, the hemoglobin takes the oxygen. Okay. But when you give it under pressure, the oxygen goes into the entire liquid as well. All right. Do you understand the difference? So now the entire liquid, which right now in us, none of us, there's no oxygen in the liquid. It's only in the RBCs. So when it's in the whole liquid, more oxygen gets carried. Then we use ozone therapy. So oxygen is O2, ozone is O3. We have found that it also has a whole lot of beneficial effects. We give it through the ear. We do cupping. We use ozone through the cupping. We also give rectal for gut cleansing. There is a gut detox plan. So for this, you have to do what is called a gut microbiome testing. We have to identify the pathogens in the gut and we try to help relieve it. And then, of course, we have to focus on diet and correcting some of those dietary problems. So we have a detailed gut detox plan. We advise foods to eat, not to eat, probiotics, prebiotics, ketogenic, gluten, gluten-free, aware of that, and what are the things to avoid, sugar, additives, pesticides, etc. A ketogenic diet which has enough protein, high fat and low carbohydrate. So micronutrient therapy is again very important. So we believe that vitamin D has to be supplemented and folinic acid has to be also given instead of folic acid. So basically the treatment of autism is multidisciplinary. You need to do all these things together. It's not, there's no silver bullet, okay? You have to do rehab, you have to work on diet, you have to do HBOT, and cell therapy is one part of it. So let's see the same parents we heard earlier.
When we came here to Neurogen, she was totally non-verbal. She had no speech. Immediately after the first shot of stem cell, that's when she started now having one word.
Less than 2 weeks from that, he was using single words like
C for cat.
Magically the water came out from the mouth, mama came out from the mouth.
Therefore, fish.
I remember the first day she called me mom, I cried. I cried because it was so emotional.
Within about 40 days, a remarkable improvement. Her eye contact is fabulous. She started sleeping on a time. That is wonderful.
Biggest game changer for Prithvi is his expressive language, his speech. He started speaking more. He even started telling us what's going on in school.
He's able to listen and he's able to understand more and he's able to learn new things.
So after stem cell, what I saw was he was able to read sentences in his mind.
Started responding to her name.
Is Eliana big? No. Eliana is up. Eliana is a good girl.
Then his writing has improved. He can read single word to sentences.
My girl finally she had speech. Please give me food. Can we go for a shopping?
Where are we
Cranberry.
And orange.
Orange.
And mixed fruit.
Mixed fruit.
High
Yeah,
five.
high five.
Now he's able to put things in sentences. Let's put on our shoes. Let's go to the car. Let's go to the plane. Let's go home. You feel now, yes, you got your life. I taught him my phone number for emergency purpose. I also taught him the address. He's able to tell me full address and he's able to write it down so that if anything happens, he's able to say my phone number.
He understands emotions. If you're happy, he's happy. If you get upset, he knows you're upset. I have seen a lot of huge differences. It's like giving a second life to a child.
So that was the same parents you heard earlier, and you can see how their kids have improved. This is a story of a child, one of our earliest kids we treated from Kentucky. The father was a cardiologist, mother is a nurse.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about Neurogen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
And now he's getting all A pluses. He's got a GPA of 3.8 out of 4. His autism is reversed, and this child now is independent of the spectrum, and his parents recently told us he traveled all over Europe alone, okay, without parents. So that is, of course, we treated him about 10 years ago. So, but this is what is possible. Okay, cerebral palsy, again, I won't, in cerebral palsy, there is more severe damage and the body is affected more than the mind. You can see the damage is more severe. There were some basic treatments, but they don't help. Now, this is the results before. You can see the damage, and post stem cell, you can see how much it has improved. Again, our work is published in scientific journals, all our results, and you can see all the improvements in oromotor skill, speech, neck holding, sitting, standing, walking, ambulation, etc. This is all the clinical data. Here's a child who was completely wheelchair bound, completely. Could not move his hands and legs at all, and it's quadriplegia. And you can see after the stem cell therapy, he's able to do so much. He's able to wear a shirt. This was impossible. He could not even move his hands. He can remove clothes, pack a bag, charge his mobile, take out water, open it. For the mother, this was a very big thing. The fact that he could take out a bottle of water, open it off, this only a mother can understand how important that is, or parent can understand. There you can see, after stem cell now, he is on his feet. Then there is intellectual disability. This is another type of neurodevelopmental disorder. Again, we have the world's first paper published on this. But here we did a comparative study. 29 patients got stem cell and rehab, and 29 got only rehab. Now see the difference. Those who got only rehab, 17% improved in cognition. Those who got stem cell and rehab, it was 55. Then memory improved in 81, stem cell and rehab, only rehab. So only rehab has improvements. When you combine with stem cell therapy, the improvements are much more. So this is the amount of improvements that you get in intellectual disability, and we have 5 papers. Now, how safe is the treatment? I'm sure as parents you're concerned about that. So there are no major adverse events, no child has deteriorated, but 3% of our children can develop epilepsy, those who have epilepsy before. This is the only concern adverse event. 10% of the kids have a spinal headache after the treatment. It lasts for 2-3 days, then it goes away. They may have some nausea, vomiting, local pain. And we've published our paper, we've published the complications. Seizure as an adverse event. Most people only publish their good data. We are the only people who published our complications as well. Let the world know that this can happen. What's the scientific basis of our work? We have 102 scientific papers in national international journals, 17 in autism. We have written chapters in textbooks. This is a textbook, Recent Advances in Autism, medical book. We have written the chapter Stem Cell Therapy in this book. We have published a total of 26 books. And all these books are available free of cost, by the way. Hard copies and soft copies. Earlier we wrote books for medical doctors. Then we found that no doctor was reading it. Who was reading our books? Parents. So then we started writing for parents, parent and teacher guidebooks. We made it simple. This was very technical. So we started writing books for parents. We have treated over 16,000 patients from 103 countries, from all the 6 continents. We have these 2 hospitals in Mumbai, Navi Mumbai. All our work is done with permission from and oversight of a health ministry registered institutional ethics committee. In America, it's called IRB, our medical board. Now, please note, it is not a cure for autism spectrum or CP. It has to be combined with conventional and comprehensive rehab. It's not a standard of care, but it is a clinical option. And what we have found is you get the best results when you accept your child the way the child is. You understand what's going on. The whole family works as a team. We find that scheduling the day properly helps. Cell therapy, rehab, correct the micronutrient imbalance, integrative therapy. So all this needs to be done together. So my conclusion is newer imaging is giving us information about which parts of the brain are affected. Newer biochemical is telling us what is happening within the brain. And new treatment, which is stem cell therapy, neurorehab, is helping reverse them. They are all safe and effective. Let's see the views of the Honorable Prime Minister of India and the previous President of the United States on stem cells. There's a book which I wrote, and the Honorable Prime Minister, Shri Narendra Modi ji, has written an introduction for my book. This is a book that I wrote, and I was very honored that he wrote this introduction. That is myself giving him a copy of the book. And this is what he had to say in Parliament.
मैं जापान गया, तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा? मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या है। हम गए तो वहाँ गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So that is the Prime Minister of India talking in the Indian Parliament about stem cells. And let's see what President Obama had to say about stem cells earlier.
Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So, this is my conclusion. This is what is happening right now. Evaluation, diagnosis, rehab, symptomatic treatment, no investigations. This is what we believe should happen. You should image the brain, do biochemistry, do genetic testing, test the gut, comprehensive rehab, cell therapy, integrative. There's a big difference between these two. And this is what we believe, this is what we are doing. We have treated over 7,000 children with autism so far, more than 3,000 children of cerebral palsy. So with that, I'd like to thank you for your attention.